A balanced diet plays a crucial role in maintaining health and preventing chronic diseases. Making small yet impactful dietary changes can significantly enhance well-being and longevity. One such change, as highlighted by a recent study from Mass General Brigham, Harvard T.H. Chan School of Public Health, and the Broad Institute of MIT and Harvard, involves replacing butter with plant-based oils in daily meals. The findings suggest that this simple substitution can reduce the risk of early mortality and improve overall health, making it a practical and effective approach for those looking to optimize their diet. The study analyzed dietary and health data from over 200,000 individuals monitored for more than 30 years. Researchers found that consuming higher amounts of plant-based oils, such as soybean oil, canola oil, and olive oil, was linked to a lower risk of death from all causes, including cancer and cardiovascular diseases. Conversely, higher butter consumption was associated with an increased risk of mortality from various causes. The results, published in JAMA Internal Medicine and presented at the American Heart Association's Epidemiology/Lifestyle Scientific Sessions, underscore the importance of choosing healthier fat sources in everyday meals. One of the key reasons why plant-based oils offer superior health benefits lies in their fat composition. Butter is high in saturated fats, which have long been associated with an increased risk of heart disease and other metabolic disorders. In contrast, plant-based oils contain higher levels of unsaturated fats, particularly monounsaturated and polyunsaturated fats, which are known to support heart health, reduce inflammation, and improve cholesterol levels. While previous research has explored the impact of different fats on health, this study uniquely focuses on specific food sources like butter and plant oils, providing more practical guidance for dietary choices. The study drew data from 3 extensive long-term studies: the Nurses' Health Study, NHS, the Nurses' Health Study 2, NHSI, and the Health Professionals Follow-Up Study, HPFS. Participants provided detailed dietary information every 4 years, allowing researchers to assess their butter and oil consumption patterns. Butter intake included all forms, such as butter spreads, butter used for cooking, and butter in baked goods. Similarly, plant oil consumption was estimated based on reported use in frying, sautéing, baking, and salad dressings. By comparing mortality rates across different levels of butter and oil consumption, researchers found that individuals who consumed the most butter had a 15% higher risk of death compared to those who consumed the least. Meanwhile, those who consumed the highest amounts of plant-based oils had a 16% lower risk of mortality. Furthermore, substituting just 10 grams of butter per day, less than a tablespoon, with an equivalent amount of plant-based oil was linked to a 17% reduction in cancer-related deaths and overall mortality rates. These findings hold significant implications for public health, as even minor dietary adjustments can lead to substantial long-term benefits. According to the study's lead author, Yu Zhang, MBBS, a research associate at Brigham and Women's Hospital and a student at Harvard T.H. Chan School of Public Health, the impact observed in the study was surprisingly strong. The ability to lower mortality risk simply by replacing butter with plant-based oils highlights the potential of dietary modifications as a powerful preventive health strategy. For those looking to make this change, incorporating plant-based oils into daily meals is both easy and practical. One simple approach is to replace butter with olive oil or canola oil when cooking, whether for frying, roasting, or grilling. Using plant-based oils in salad dressings, marinades, and homemade sauces can also provide a flavorful and health-conscious alternative. When baking, substituting butter with vegetable oils can help maintain moisture and texture while reducing saturated fat intake. Even small swaps, such as drizzling olive oil over bread instead of spreading butter, can contribute to a healthier diet over time. Beyond individual health benefits, shifting towards plant-based oils also aligns with broader dietary recommendations from organizations such as the American Heart Association and the World Health Organization. These organizations advocate for reducing saturated fat intake and increasing consumption of unsaturated fats to support cardiovascular health and prevent chronic diseases. The findings from this study provide further evidence supporting these recommendations, reinforcing the idea that dietary choices play a fundamental role in shaping long-term health outcomes. While the study primarily focused on healthcare professionals who may not fully represent the general population, Its conclusions are consistent with existing research on dietary fats and health. Moving forward, researchers aim to explore the biological mechanisms behind these effects in greater depth, shedding light on how specific fats influence disease development and longevity. Ultimately, adopting healthier dietary habits does not require drastic changes. Small, mindful adjustments can yield substantial benefits. Choosing plant-based oils over butter is an accessible and effective step toward better health, helping to lower the risk of chronic diseases, enhance metabolic function, and promote longevity. By making simple yet informed choices, individuals can take control of their well-being and build a more sustainable and health-conscious diet.